how do you protect yourself, right? Like, how do you support your immune system so you're more resilient? And as we know from the coronavirus, COVID-19, your body can handle way more than what the government tells you it can. Welcome back to the podcast. Today we are diving into probably the most controversial subject matter in the last decade, and that is COVID-19. When we think about the last few years, it's really wild to look back and reflect on all the societal changes, the medical interventions that were recommended, social distancing, the truth about the virus itself and how it's transmitted and spread, and even the origin of it. So today, the goal is to look back and say, hey, what do we know now that we didn't know back then? Like, what is truth today that was unclear in the past, and whether that was communicated out of deceit for financial gain, or whether that was come to the market quickly with a vaccine for financial gain. Maybe that's true. It's really not. It's not. My goal is not to just bash the big pharma, because we could all do that, but it gets us nowhere, right? We know these corporations are in it for high dollar returns. My goal is to help equip you with information that could transform your health. And not just for you, but for your family. It's also going to be coronavirus season, C viruses, COVID-19, flu, influenzas coming around. Right now, we're seeing a definite surge in COVID-related cases. So that bug seems to be peaking at this moment. So how do you protect yourself, right? Like, how do you support your immune system so you're more resilient? And as we know from the coronavirus, COVID-19, your body can handle way more than what the government tells you it can. Let me just be real with you. Natural immunity still exists. So if you can create a more robust immune system, right, rather than live in a state of chronic disease, well, it was pretty obvious the last few years who lived through the epidemic and who didn't. And comorbidities, multiple comorbidities, and chronic disease was definitely impacted the most. And so that's what we're going to do. We're going to talk through that today, now that emotions have somewhat settled down, even though Fauci's on trial for all his stuff. For the most part, we're all kind of clear-headed in what we've seen transpire the last few years and what we need to do to equip ourselves heading forward. And this really isn't about politics. This is about a public health event that happened and that we have to learn from. And so maybe you're in the camp where you've changed your narrative, what you believe about who you're trusting, and what you believe about health, right? That's not a bad thing. So I hope we all grew from it. And so let's get into, I think one of the biggest lessons from COVID wasn't just about the viruses. Really, it came down to trusting the communication of certain officials. And many public health recommendations were presented with a level of certainty that when we look back later on, we realize that that changed as evidence became more available, that weren't the best recommendations at all, that created more harm than good. I mean, social distancing was one of the, in my opinion, worst recommendations given, just from a psychological perspective, what that did to young kids and what that did to families, what that did to individuals who were just stuck in a box at home all day. And so I don't think that necessarily means that every communication was given in bad faith, but it definitely means that when we look back, topics have evolved in terms of mask recommendations, which was just silly. School closures, right? We saw lockdowns happen, and We even had conversations about, hey, is there such thing as natural immunity? And as we know today, right, we have changed, for the most part, when we say we as a societal whole have changed our viewpoint quite a bit. Now, there's some people that still believe that some of those things that were communicated a few years ago are still true today. But if you just look at research and evidence, we can clearly see that the subject matter has changed. The information is different, and the recommendations, therefore, should be changed heading forward. And so I think several things are much clearer today than they were in 2020. And the first is that natural immunity does meaningful protection against infection. And then to kind of support that narrative, we just look at kids who have stronger natural immunities, and they were the ones that handled it the best. But as we got sicker and we had more comorbidities and we were fatter and more inflamed and had diabetes and the list goes on, that natural immunity waned, and we didn't have it as an effective resiliency to the virus. We also know that natural immunity does wane, that the inevitable is you're probably going to have a COVID-19 viral load again. You're probably going to have symptoms from a coronavirus, influenza virus. Your immune system is going to come up against that organism again. And how strong, how robust, how resilient is your immune system today compared to where it was a few years ago? Well, it's obviously seen the virus, it's recognized it. Natural immunity may wane, but we can build our natural immune system so that when we do get exposed to these viral loads, we have a much better ability to handle them and to fight them effectively. We know that the whole issue of where it came from, right? Like research-based labs, that it probably came from lab origin. And as we look at some of the craziest viruses, like let's just take RSV for instance, that respiratory virus that is so impactful to kids, puts kids in hospitals, kills kids every year. That was a lab-made virus. And if we look at COVID-19, it's a lab-made virus. These lab-made viruses, they have detrimental effects on our immune system, and they hammer us pretty hard. And so the reality is probably in the future, there will be more man-made viruses that get into circulation, and you've got to be ready for it. That's just a reality. I don't know if it's going to be, if you can't avoid it, right? I mean, like even the social distancing and stay in a room and, don't come out and give your food handed to you in gloves with the person holding the mask over their face. Yeah, well, they still got it. They still got exposed to the virus. And you're not going to avoid it forever. If you live in society, you will not avoid viruses. They will come for you. But you shouldn't be scared. We should be strong and protective and robust and resilient. It's the same thing with other bugs like strep or staph or other bacterial infections. When the immune system is strong, it's able to handle infections well, natural immunity. But when it's not strong, it's weakened, that's when we're in trouble. I think one of the biggest things that we saw was when we looked at vaccine safety, and we pushed this vaccine to market quickly, yet then we're like, yeah, it's safe for everyone, just like we always say about vaccines, that they're safe for everyone. There's no issues, right? They're safe and effective is the verbiage that's used. Yet, I mean, we have adverse effects like myocarditis, pericarditis. We have thrombosis or blood clots, thickening of the blood. We have so many detrimental effects that are potentially life-altering from a vaccine, where in healthy individuals, right, especially kids, especially healthy young adults, could handle this virus without complications, yet could then have a heart attack or a blood clot in their lung from a vaccine that they didn't need. And that is a reality that we have to look at the risks with being vaccinated and the risks with being unvaccinated. Only you can make that decision, that informed consent decision with your medical provider. I'm not here to tell you what to do. I'm not here to tell you to go one way or the other. It is your job. It is you as a parent, it's your job to lead your kids in a meaningful way, in an intentional way with the information that you gather, right? Don't let me or any other person tell you what to do. You take in the information and use wisdom to decide what's the best course of action for your family. And so patients, they deserve informed consent. And I think that's where we've lost our trust in our medical society, is that it's like, hey, just do this because I told you to do it, versus, hey, let's have a conversation. And gosh, I love talking to practitioners, physicians who are just willing to have conversations and be unbiased, non-dogmatic, and just be neutral and just say, hey, let's just talk through it. Let's talk through the COVID vaccine, or let's talk through maybe other vaccines that you're potentially going to give to your children, or a medication intervention, or a surgical operation, or a chiropractic adjustment. Let's talk about the benefit. Let's talk about the risks and have an informed consent that then inevitably builds trust within that practitioner, because you had a quality, meaningful conversation. It's like we've lost the ability to have meaningful conversations. And more important than anything, right now we need to have quality, informed consent. And so I think COVID, what exposed about our health is that one thing became very, very clear about the pandemic, in that it was the people at the greatest risk for illness often shared common characteristics: obesity, type 2 diabetes, insulin resistance, cardiovascular disease, chronic inflammation, poor metabolic health. These are the people that were impacted the most. Viruses matter, but the health of the host matters most. Viruses matter, but the health of the host matters most. Now, I'm going to say that one more time, because viruses do matter. Viruses can impact everyone, but the health of the host matters the most, in the way that they can build a natural immune system that's supportive to overcoming that viral load or that bacterial pathogen. And so what we can do is just be intentional with this upcoming flu, cold season coming ahead. I mean, kids are going to go back to school. There's going to be more exposures to viruses and hand, foot, mouth, and cold and flu. And so what do we do? What are ways to prepare your body to build a healthy, natural, robust, resilient immune system? Get adjusted. That's number one. Go get adjusted. Stay adjusted. Get in your wellness weekly care role, because chiropractic care can influence the immune system in a way that nothing else can. Number two, make sure you check your vitamin D levels. We know that better vitamin D levels were more resilient to the long-standing COVID effects that we saw. What is your vitamin D? Is it 20, 30, 40, 50? It needs to be at least 60 to 70. That would be a sweet spot. So where's your vitamin D levels, and supplement accordingly. Number three, get enough sleep. Get restful, deep, restorative sleep. 7 to 8 hours every night. Kids need more. Make sure you're going to sleep at the same time, waking up at the same time. Number four, let's make sure that you are eating meaningful, whole foods that's not full of sugar. Don't give your kids a bunch of juice boxes and fruit snacks during cold and flu season, right? We see sugar directly lowers the immune system for hours after the consumption of it. So the worst thing you could do is, when your kid says sniffly and sneezy, don't give them a juice box and fruit snacks, right? Because they're immediately going to have a negative impact to their immune system that's going to linger that viral load longer. It's going to make that virus have longer effects in the body. Do not use sugar and juices for your kids' immune system health, okay? We know that to be true, but yet we still do it, right? We also give ultra-processed foods that are absolutely wreaking havoc on immune health, so make sure that your kids, you're controlling what you can control. Maybe that's just breakfast and dinner, but you're controlling what you can control and making sure they're eating quality, whole foods every single day. Make sure in these next few months you get out and you get into sunlight, as sunlight has such a dramatic effect on the immune system. Walk outside, walk out in the sun, and get as much sunlight as you can, because as the winter comes in and we don't see the sun as much, we do get naturally lowered immune health. Protein is one of the best ways to actually help strengthen the immune system. Amino acids are needed literally to form an immune system response and allow cellular repair to happen. So if you're not consuming the building blocks of the body, which is protein, amino acids, then we are definitely going to be starving our immune system from functioning well. And then for me, I think there's some great supplements out there outside the vitamin D recommendation. I think vitamin C is impactful. I do think mushrooms are fantastic, like reishi, like turkey tail. There's a great company called Five Defenders. They make a really good product that you can take daily to build healthy, natural immune system health. I think there's some really good antivirals out there that we can consume. L-lysine plays a role. I just mentioned vitamin C plays a role. Colostrum plays a role. But I would warn against taking immune supplements every day, because a lot of people don't know what's in them, and some of them are just too strong to be taking every day. Like echinacea, you don't need to be taking that every day. There are some dangers with that. There are dangers with taking just random herbs and certain quantities that could negatively impact you, and what you think is being beneficial can be actually detrimental. So just be mindful of how you're supplementing and what you're supplementing with, and make sure you're working with a healthcare practitioner to guide you and your kids on what is appropriate and how to take it properly. The foundations are true. If we eat well, move well, sleep well, get adjusted, and we are properly supporting our stress, you are going to build a healthy, robust immune system. If you're eating junk food, processed foods, sugars, not sleeping well, drinking alcohol, right, you are going to see the effects of that. So choose wisely, right? And if you build a healthy immune system, then it doesn't really matter what comes your way. You don't have to live in fear. You can live in a state of faith, knowing that you have invested well in your body. Your body's a temple, and it will fight off whatever comes its way. So when we look back from where we were to where we're at now, we know so much more. But the truth still, the thread of truth remains the same. Control what you can control. Build health today, and don't leave it to anyone else to tell you what to do when the next pandemic comes, because there will be another pandemic. That is the reality of today. So this is me signing off for another episode of the Real Health Podcast.